Hello. Thank you for joining me again today. Dr. Geoffrey, crisis and split-second decisions expert here on our Medical Monday, just to update you on a few matters that are going on. Thank you very much for joining me today. And it's Martin Luther King Day. I'm praying that everyone did some kind of service. And we're going to get on with what we're going to talk about today. A lot's moving, a lot is happening fast. Forgive the late notice as it relates to the Medical Monday. While we're waiting on a few people to jump in and to chime in, let me set it up this way. It is Martin Luther King weekend, and he asked us to be open-minded. He wanted freedom. He wanted us to be on the pathway of justice. I say all of that to I say, what has happened, and I don't know why, but I've got a number of people who disagree with my lives and COVID. Fortunately, because of Martin Luther King, you've got the freedom to not listen. There's no need to mail me, email me, get on my Facebook page. There's no need. Martin Luther King has helped give us the freedom where you don't have to listen. There's a billion different other channels, Facebook pages, Instagram. Oh, by the way, my Instagram page is at Dr. Saving Lives. And if you follow me on Facebook, please follow me on Instagram as well. But back to what I was saying. So for those people who disagree with what I'm saying, no need to drop a letter in the mailbox. No need to email me. No need to post mean stuff on my Facebook page. Just don't listen. Because again, this channel is about the only rule I have on this channel is to be kind. That's the only rule that I have is to be kind. So let's just make sure that we're kind to one another. One thing that we are sure about is that we are all in this chronic crisis. It's a slow burn, which means that every time we reach past a point and we think we're on the other end of the crisis, something else happens. And so this is slow burn crisis. And as a result, people are getting tired. When people get tired, often they get discouraged. Our goal is to educate and encourage and to make people feel better. I thank you all for those of you who reached out and said, hey, I contacted 3 people. It made me feel better. I would encourage everyone to contact a few people so that you feel better as well. Let's roll right into it. Today's talk is about, let me set it up this way. I have not done a randomized control study, but talking to a number of colleagues across the country, I can say this without fear of contradiction. Most medical providers, especially those on the front line, have not been asked to take a COVID test. No one has asked them to take a COVID test. Many of those who did take it, they took it on their own because of high risk exposure or in their personal lives. They need to travel or get a medical procedure done, but most have not voluntarily taken a COVID test. Combine that with the fact that many states are allowing providers who are COVID positive to still work, with the caveats that they have to be asymptomatic. And I think that's reasonable. Why? We're in a crisis. We're running short on providers, and we always say that the PPEs and the masks work. Therefore, it works in both ways. But in case you're being taken care of by a medical provider, there are 6 steps that you should take. Again, there are 6 steps that you should take. The first step is, let me just give you an update as promised. As of January 18th, the number of new cases in this country has decreased. It has decreased by 7%. Great job. Let's hope that's not just a blip. The number of deaths have increased. But as we've learned in this, the number of cases decreasing does not, the number of deaths does not instantly follow. It usually lags behind by about 10 to 14 days. Don't be alarmed if you see the number of deaths continue to increase. But great job in terms of the number of cases, of COVID positive cases, they have decreased. Now let's get back to the 6 steps that you should take when going to your medical provider, especially the ER. 6 steps that you should take when going to the medical provider, especially the ER. Number 1 is you should make sure you wear a mask while being treated, and make sure your provider wears a mask. You wearing a mask and your provider. When I say provider, I just don't mean medical doctor. I mean anyone along that healthcare chain, security, techs, nurses, registration. Make sure that they have their mask on appropriately. I know it seems like common sense, but hey, let me be honest. Everyone is experiencing some kind of fatigue. When you go to the ER, it's very important for you not to be fatigued and be on your game. Number 2, this one is difficult, but you've got to be your healthcare representative. Unless they are examining you, ask them to step away. So they can ask you questions from across the room. Unless they're examining, once they need to examine you, obviously it's in your best interest to let them come in and examine you. But otherwise, just for regular questions and they're getting you through the history, they can be further away from you than what we're accustomed to in the past. Number 3, and it may be difficult for you, but ask all hospital personnel before they touch you to please wash their hands. And even if they have to hand you a pen to sign something, you put on a glove, ask them to wash a pen, something. But anyone who's about to touch you, make sure that they wash their hands. Number 6, number 4, you wear gloves if you can. If not, use hand sanitizer, and there's plenty of it in most hospitals and ERs, as much as you can, and don't touch your face. Because don't forget, the main way COVID gets into you is through your mouth and nose. So you don't want to touch something and then touch your mouth or face. Then the next one is request that the provider seeing you wipe off any medical equipment, stethoscope, ultrasound, otoscope, a thumoscope. Ask them to please wipe it off before they touch you. Then the next one is avoid touching any surfaces. Yes, COVID, while we've learned it doesn't happen as often, but COVID can be spread from surface to mouth. Meaning if I sneeze here and there's COVID and someone comes behind me shortly after and there's COVID there and I touch my mouth, yes, I can contract COVID that way. And then finally, ask them to leave the door open wherever they are treating you. Why? It helps with the circulation. It helps with the ventilation. We've all learned that that one way to decrease the concentration of the virus is to make sure there's plenty of ventilation and a lot of concentration. Plenty of ventilation and a lot of concentration. Everybody. I would encourage you. There'll be an article coming out about the 6 steps that you should take when being treated by your medical provider. But this is not the time to get tired. This is not the time to get sick. I would encourage you all to also follow me on YouTube, follow me on Instagram, follow me on LinkedIn, and follow me on any of the shows I'm on. Not advertising them now just because if I miss one, it becomes an issue. Let's just take a few questions. What's up, Sheila Edwards from Germany? That's what I'm talking about, Germany. Princess. Hey, what's up, Princess? What's going on? Austin Deckers. Okay. Louis Alexander, what's going on? Happy service day to you too as well. Lonnie, what's going on with you? Yes, day of service, no doubt. I always carry my own pen these days. Good. How do you handle door handles? No pun taken. A few different things. If I don't have a glove, if I don't have something to like touch it, sometimes I just sit and wait for somebody to like come out. Or worst case is I'll take a part of my sleeve that I know is not going to come towards my mouth, or I probably will not be touching. It's usually the elbow, and I'll reach around and I'll pull it that way. But I try not to get in that situation. But let me end this with a story about why this came to my attention. So I was working in an ER in Virginia, maybe yesterday. And keep in mind, everyone's fatigued, everyone's tired. We've got processes in place. Our COVID patients, we put in one area. Our COVID symptoms, we put in another area. And the rest of the patients, we put in a different area. Well, on this particular day, we for the patient who didn't have any COVID symptoms and put them in a non-COVID area. And, because the ER, the patients who are placed all around, following all requirements. Just so happens we're treating this patient or waiting for tests to come back. Everything's come back negative. And so I read up the discharge papers. I said, hold on, let's just do a COVID test. This is an ER that allows you to do a COVID test for non-admitted patients. And she came back COVID positive. Who would have thought that this person came back COVID positive? Therefore, we had to contact those patients who were next to her, some of the nurses, not everyone wore N95. So, and mind you, I wouldn't say it was a fault in the system. I know that you all would, but the system's not perfect. The system's not perfect by any means. And when it's not a perfect system, we need everyone to play their role as well. But I've got to give kudos to the medical profession, to the nurses, to the doctors, because we're fatigued, we're doing our part, and we are saving lives. And I'll be honest with you, I've never seen nurses perform at this level in my plus years of medicine, and as well as the techs, everybody. A few other questions here. Sandy from Arizona, what is going on with you? Lonnie, very good point. And then Lonnie says, by the way, I checked in on my older uncle and aunt. They received their vaccinations today in Philly. Fantastic. They've been getting testing and received from the Black Doctors COVID Consortium. Hey, thank you very much for putting that in there. I'm glad that they got tested. I'm glad that they received their vaccine. If you all wonder why I still keep talking about this vaccine, given all the numbers, given what's going on, there are a number of people. You all, because you're an educated audience, I mean, you're educated in terms of the vaccine and the virus, there are still quite a number of people who are adamant about not getting the vaccine, adamant about it. And they will send me letters now, like, how dare you, yada, 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 yada. I say this, it's very important for you all to be super users, And at a minimum, this is my new position, at a minimum, hey, you know, vaxxers, there's no need talking about it. All that I ask you to do me a favor is make sure it's available for those in your community. Make sure it's available for those in your community. So again, we all have to do our part in this. Hey, newbie, what's going on? Good afternoon, doctor. Always great to vibe with you. Thanks for sharing. It's cool. Great. Hey, no problem. Sandy, yes, I'm at a nursing facility and we are hit hard. Yeah, Sandy Green. So the nursing facilities are being hit hard. And those who are taking care of the patients are being hit hard as well. So I would ask you again, everyone do their part. Hey, Sandy, thank you for your efforts. Kim Leah, hey, what's going on, Kim Leah? Everybody, we are entering into a difficult time. This too will pass. We've got to put our crisis hat on. We've got to make some deliberate decisions as well as some split-second decisions. We have to. I'm going to put this as gently as possible. Be prepared for in case you or your loved one or someone you know contracts COVID. Look at my previous live in terms of the 6 items you should have at home in case you get COVID. Obviously, the goal is for you not to get COVID, but in case you do, this is time. Let me just take a word on the vitamin D. There are several articles that continue to suggest that vitamin D saves lives. There are a number of articles. There are also several articles that say, it may not. And the only way to do it is by randomized controlled trials. That's what's happening now. But there's a lot of articles pre-COVID that talks about vitamin D and respiratory infections and how they can save lives. But if we look at it from a risk-benefit point of view, let's say the articles are right, that vitamin D saves lives. From a risk point of view, wow, you don't want to miss that. And if they're wrong, there was minimum risk. So from a risk-benefit analysis, I highly continue to recommend vitamin D. But most importantly, I recommend mask. Mask. And what we've learned a few lives ago, the quality of the mask is absolutely key. Cheap little gator mask, they don't do much. A nice quality mask that has at least 2 layers on it, that's where you want to go. A few more questions, then we are going to get out of here. Hey, Patricia Marshall, what's going on with you? Hampton hugs to you as well. I will end this with what I always end it with. Well, not always, but most of the time. Please be sure to reach out to 3 people today, especially on Martin Luther King Day where people are home, they're home alone. Reach out to them and say, hey, I'm just calling, check on you. It doesn't have to be a long conversation. I'll be honest with you. There's 1 or 2 people I've called and they want to have a long conversation. I was like, bro. I'm just checking in on you. And, if I found that there was a need to have a longer conversation, great. But I can just tell you, it will make you feel better to call and check on someone as well. And it will help them feel better. It's a win-win conversation. Again, it's a win-win conversation. We're going to get out of here. I'm going to summarize just like real quick. The 6 steps that you must take when you go to see your provider, because many states have said that it's okay for their providers to be COVID positive. It's okay for the providers to be COVID positive. I actually agree with that. And in case you're COVID positive, and because you're going into an environment where there's a lot of COVID, these are 6 things that you must do. Wear your mask and make sure that the providers wear their mask. Providers means when you walk in that door, clerks, techs, registration, security, nurses, and make sure the mask is above their nose. It's almost useless to wear a mask and your nose is exposed. I only said almost. 2, unless the provider is examining you, have them step back. And you can have the conversation that way. 3, make sure that all personnel who are about to touch you for any reason, make sure they wash their hands first. And you can do it gently. You can say, hey, did you wash your hands? It's not to be aggressive. You can do it gently. 5, wear your glove. 4, wear your gloves at all times. Or wash your hands with hand sanitizers at all times. And this is a big one. Request that any time they're about to touch you with any medical equipment, ultrasound, stethoscope, otoscope, thermoscope, EKG machine, whatever, ask them to please wipe it off first. Again, to please wipe it off first. Avoid any touching any surfaces and then touching your mouth. And then ask them to leave the treatment room door open if possible, because it helps with the ventilation and it decreases the concentration of the virus. Hey, everybody, this is Geoffrey. We're about to I still don't want to go to the dentist. Any thoughts? I hear you not want to go to the dentist, Lonnie. I recommend going. You heard pretty many lives ago, my dentist would not see me, but we don't know how long we're going to be in this space. So if there's any way you can go to the dentist, I would say go. They are at greater risk, but I've noticed that most of them have purchased the extra equipment as well. But if your teeth are healthy and everything's good, if you wait, so be it. Oh, by the way, anything I say is not meant to be medical advice. It's just for information purposes only. Make sure you all follow me on Instagram. Make sure you follow at Dr. Geoffrey. I'm sorry, Dr. Saving Lives. At Dr. Saving Lives. Make sure you follow me on my YouTube channel, which is YouTube.com/Dr. Geoffrey. Thank you all very much for listening. Be safe. This will pass too. And make sure you do something kind for someone. I'll talk to you soon.